Well, we have a great deal of work to do. We still look at, we have the blueprint that has been installed and the realignment. And so we have major cost drivers that we have to go and deal with. We have major cost drivers such as the court orders. We have that we have to contend with. We have also employee compensation costs that has increased significantly in our budget. We also had our infill projects as well as the vacancies. So we have the academy that we had expanded as well. So those are the things that we are looking at to be able to look at CDCR and be able to change anything we can to bring down the population and bring down our budget.
Got it. That's all for me. Thank you very much.
Thank you, Senator Mitchell. Mr. Cannella.
Thank you, Senator. We had a nice discussion as well, and I think you're qualified for the job. I think it's great that we have an outside person coming in that can look at it with a fresh perspective, but I do want to just touch on again the budget, because part of realignment was it was going to be a significant cost savings to the state of California. Well, now we are a few years into it, and this is information your office sent us, the 2011-12 pre-realignment, the budget was about $10 billion. We saved some money. 12-13, it was down to $9 billion. 13-14, $9 billion. 14-15, $9.8, and now it's back up to $10.2 billion. So we're actually more expensive, and tens of thousands of inmates have been sent down to the county level. So what's going on? I mean, we're not seeing any savings, and we're actually seeing increased cost when we've released prisoners down to the local level. So can you explain what's happening?
Well, that's correct. We have, again, the blueprint and the realignment that had actually baselined our standard staffing. However, because of those increases is due to the court orders. We've had so many of those competing priorities that the court orders had actually increased our budget. We've also had, like I said, the employee compensation. We had, due to bargaining contracts, increases in that effect. We've had, we're trying to reduce our population, therefore we have the infill projects of R.J. Donovan and the Mule Creek to increase our capacity so that we're bringing down the population. And then because of the vacancies of our correctional officers, we had our academy that was expanded so that we could be able to reduce the vacancies and also reduce the overtime.
Yeah. So how much have we reduced the prison population since realignment? Do you know that?
I don't have that information offhand. I
think it's around 40,000, if I'm not mistaken. So I understand the court order, and again, this isn't your problem. You're 5 months into it, so it certainly isn't your doing, but I still think it's important for us to understand what's happening in corrections.
Yes.
So if we release the population by, say, 40,000, and now we're higher than we were when we had, the more inmates, it seems like we're complying with the court order. I guess, how is the court order making it more expensive when we actually have released prisoners? What court order?
Well, we have like the Plata, the Coleman for mental health.
But we had that before, didn't we? I mean, that's what created this whole problem.
Right, that's what we had installed, which we had the receiver that's now over a portion of our mental and health care. But because we were looking at realignment to try to effectuate change and bring down the population.
Which we have.
And we have, but we don't know how, we don't have enough data to go and look at long-term on how it's going to continue to bring those population down. Standardized staffing has been in place. We have a baseline of the staff, but in order for actually, as the population goes down, standardized staffing doesn't allow for, or doesn't actually have the need to be able to reduce down the budget, because the budget's going to remain the same in terms of staffing as the population goes up and down in the inmates. The only way that you could actually save money is to actually close down prisons.
Yeah, which we don't want to do. But
no,
again, the whole purpose, there was a few purposes with realignment. One of them was to meet the court order. It was unsafe, it was overcrowded.
Right.
But also it was to save money.
Correct.
Now we're into it and we aren't saving any money. So.
Well, in the first 2 years, we did meet our fiscal obligations in terms of the blueprint. Department of Finance as well as the OIG actually reviewed our fiscal and we met the blueprint. But again, yes, because of all these other avenues and issues that had come after the blueprint and after realignment, beyond our control, those had increased our budget.
Well, so maybe the way I need to look at it is, yes, we have not saved money at this point, but maybe if we still had the same population of prisoners, it would have been a lot more. So
Correct.
maybe the increase is not there because we've lowered the prison population. But these are the things I hope you're going to look at, because obviously, if we're spending $64,000, whatever the number is, per inmate, I hope it doesn't cost that much for me to educate my kids when it comes to college.
Right.
We're kind of unbalanced there, so we've got to understand, what are we spending our money on? And I honestly, I don't think I didn't really ask the question directly, but if we want to know exactly why the increases occurred, that should be information that's readily available. Here's exactly what happened. Here's exactly why the costs have
Yep.
gone up. Because that way, as policymakers, when we're wrestling with budget issues, we can make decisions based on, all the facts, and we can put the money where it's best spent. So,
Yeah, absolutely.
anyway, with all that, I think you're going to do a fine job. I think that you're the right person for the job, but we've got a lot of work to do.
Yeah, I agree. Thank you.
Thank you very much, Mr. Cannella. Let's go back to Senator Mitchell.
I'm sorry, it was a question that the senator asked that I just wanted clarification. What role, if any, do you play in developing CDCR's budget? My assumption was that your role as a top-level administrator was to manage it. Are you involved in the budget development aspect on
Well,
the
in
front
ter-
end?
In terms of the actual budget that's being developed, my budget shop is a part of it, and we do
Okay.
manage that.
But you manage it on the back end, but in terms of, do you work with Department of Finance in terms of developing the numbers that go into the governor's budget?
That's true, yes,
Okay.
we do all of that, as well
Okay.
as we actually manage the budget in itself.
Got it.
We actually have tools in place to be able to, what we call availability control, to actually identify the budget. It has monitors the spending of the budget based on the allocations of the allocated resources. And we actually look at that. We have meetings on it. If there was any types of allocations that may be expended, we're able to look at that. I have the fiscal responsibility of the oversight of it and making sure that the health of that budget is in check. If there's any type of issues, it's the accountability of some of the other managers. We speak about it. We speak to the legislature if necessary. But one of the other added benefits of our budget is that we're going to be actually implementing an additional tool to be able to monitor our budget, and which is called BFF. And yes, it's actually going to be my best friend. But it's actually budget fiscal forecasting. And it actually allows us to look at real-time numbers immediately to be able to look at any type of procurements, requisitions at an immediate level, and to be able to project costs for a budget so that discussions will happen immediately if there's any issues.
So projections can be closer to
What it's
reality.
like,
which is
yes,
always, I
and we
think-
realign it as well.
And that's always a challenge I've experienced as a budget committee member with finance, that projections are, it's an art apparently, not a science. But it
Yes.
sounds like the tools you
That's it.
have will bring it back over closer to a science. And just looking at this chart in terms of California's corrections expenditures in our materials, I think it's clear that from 76, 77 fiscal year up to a high peak of probably right when we passed realignment, which is 06, 07, it was a pretty consistent, it looks like climbing the Alps here, pretty consistent upward trend. And then there was a pretty significant dip. And so I think it's clear that if realignment, some of those actions hadn't been taken, it would have continued on a pretty steep incline. So I just wanted to be clear in terms of, and I think it is also important to have someone there who is, once the budget is passed, is managing it closely, so we don't continue to have the experience of adjustments made, in the first calendar year of the fiscal year of the budget, when those projections are off. So managing that tightly, I think, is critically important as well.
Yes, thank you.
Thank you much, Ms. Mitchell. Madam Vice Chair.
Well, you have a really large job, and I'm impressed that you can oversee both accounting and HR, it sounds like. Is that
Yes.
correct? And is there another department in there that we're missing?
We have personnel, we have the budgets, we have accounting, and also policy, and then also the contracts. We have our business services contracts.
And approximately how many employees do you oversee in that group?
I have approximately about 1,200 people.
And of that, we know that you're new, and so what you inherited was a real flex in interim positions and vacancies, which usually leads to overtime rises and also administrative overhead cost rise based on the recruiting for the lower wage jobs, the lower wage interims, and they're all short term. So in the end, even though you gain a little bit on the lower wage, you lose on the management process. So I'm assuming that when you came in, you looked that all over and you said, I want to stabilize this, and maybe when the realignment population stabilizes, I'll be able to stabilize this.
Yes.
So what did you find in terms of percentages of overtime rising above the budget estimates?
Well, what I do know is that overtime has been historically definitely an issue. And the overtime is primarily part and parcel to our vacancies.
Yes.
And
usually.
so what we are doing, I'm doing is that we're looking at specifically filling those vacancies to reduce down the overtime. And by doing that, we have the academy in Galt that we are ramping up, and we're getting as many cadets as possible through that to graduate the cadets, to get them in to the institutions to reduce that overtime.
And do you have any estimates of how much overtime there is to reduce and over what amount of time you might be able to do that?
I wish I had that answer for you. I am looking into RLR budget as well as the overtime associated with that. We have our HR staff as well as our adult institutions director involved in constant discussions on overtime. But I could get more specifics for you and provide that to you later or even as a
That would be
briefing.
great. I think the first way to solve the realignment cost rise,
Yes.
and since you have a new position, the biggest challenge you really have before you in order to get your budget under control, not your fault, but that's what you inherited.
Yep.
Is getting a handle on what the overtime is, what percentage of overtime has been used beyond the budgeted amount, and then a plan for how you bring that down. And oftentimes, it's partly in how much faster you recruit and how much faster you train.
That's right.
So your academies may have to change in nature as well. It's a big job. But if you can do that, overall, the employees' working conditions are improved. The clients' holding conditions are improved.
Right.
And overall, your budget is going to be more predictable for you. So if you can get me those, just so I can be reassured that you're on point.
Sure.
Then I would be happy to vote for you in this hearing in order to give you the chance to make the changes you need as a new person.
Absolutely.
Thank you.
Thank you very much, Madam Vice Chair. Ms. Leyva.
Good afternoon, Ms. Shimazu. Good to see you again.
Nice to meet you.
I have to agree with the governor. I think that you bring a fresh set of eyes and a fresh perspective, which is very much needed. I think your HR background will serve all of us very well. I enjoyed our conversation. We spoke a good bit about the overtime. Really today, all I wanted to do is thank you very much for your prompt attention to the issue I brought to you about the Chino prisons. If I didn't think you were going to do great at the job, I sure do now. Within 24 hours, we had an answer. Thank you very much. Greatly
Welcome.
appreciate it.
Thank you.
Thank you very much, Ms. Leyva. Ms. Shimazu, Just a few questions. I know we talked about some of the cost drivers. I know it's Plata dealing with medical, and I think it's Paras dealing with dental, and I can't think of the other one on mental health. I think it's Coleman, you know, and then we have the three-judge panel, the $400 million appropriation, you know. But this is an ongoing issue with regards to some of the figures that were discussed with regards to pre-alignment and every other fiscal year subsequently, where we've had some cost savings, you know, in several fiscal years. And the recent fiscal year, obviously, we've gone above and beyond the prior fiscal year. The cost drivers are obviously, you articulated the three-judge panel, the $400 million, and other aspects of it. And I think to members of both the Senate as well as the Assembly, as well as to the public at large, there's confusion, you know, when you see, when there is no correlation, or people say there is no correlation between inmate population that has decreased, yet a budget that has grown, you know. I want you to get a little deeper in some of the cost drivers, and more specifically, I want to hear from you, what can we do to actually start containing some of these costs as we move forward? Is it in fact achievable through your perspective, given we're in a realignment period where we have less, you know, not more, but on paper and money-wise, when we make our
Right.
appropriations, when we make our budgetary decisions, I think there's a lot of consternation, a lot of heartache, because folks want to invest in California. They want to invest in education. They want to invest in higher education. They want to invest in childcare. And then when the public at large sees, you know, inmate population dropping, yet obviously a continued growth in the budget, there's a lot of confusion. There's a lot of anger in general. So why don't you share a few perspectives on that?
Well, you're absolutely right that there is our constant challenges, the facilities, aging facilities that we need to take care of. We have a number of prisons that are just really in dilapidated type of form right now. The court orders, that is significant in terms of the cost drivers here. That is beyond our control. Those court orders were put in place for a reason. In the past, CDCR had not been doing what needed to be done in terms of being able to provide constitutional care for our inmates. And so as we go forward, we need a durable solution. And those solutions I wish I had. However, there will be discussions with the secretary and the governor, as well as the legislature, to be able to determine what that durable solution will be. But once that decision has been made, I will be the one to assist in making those solutions a reality as we go forward in the future.
How often do you meet with the Secretary of CDCR as well as the wardens?
I'm sorry?
How often do you meet with the Secretary of CDCR as well as the wardens?
I meet with the secretary monthly, but I also meet with them on impromptu. I will be meeting with the wardens next month, as a matter of fact.
And how often is that with the wardens?
They have a quarterly meeting, I believe, and since I've only been here for 5 months,
Sure.
I will be meeting with them.
First time?
Yeah,
Okay,
exactly.
Okay, all righty. Going forward, what are some cost savers that you anticipate that are within a reality?
Well, some of the cost savings that we have already kind of in place has been, we had a work group, overall workers' comp, who actually looked at the increases of cost of workers' comp. And those increases costs were basically because of the law, they had doubled the weekly pay from $490 to like $1,100 a week, as well as services fees to SCIF, that increased.
So we got workers' comp.
Workers' comp
Okay.
is primarily a significant increase to our budget. However, part of the cost savings, what I'm getting at, is in workers' comp. We had a work group that had been compiled and looked at workers' comp specifically. We had primarily looked at the auditing of each one of those claims and saw that we actually saved $17 million. And because of the review of those workers' comp claims that they actually now have in our legal department, staff that is permanently there to be able to review and reduce and contain those costs of workers' comp. So that's one of the savings we are already currently and in the future looking at.
Okay, so we have cost containments in workers' comp. What else?
Well, we also, gosh, I think off the top of my head all of a sudden, as we have a durable solution and we look at the population that decreases, we hope to be able to effectuate changes to reduce costs in our budget in the future.
Okay, and the reason why I say this sort of in general is you have members of the legislature on both sides of the aisle, on both chambers, looking for every dollar, looking for every penny, because they want to make investments. They want to invest in young men and young women. They want to invest in children, so they don't end up in the hands of CDCR. And that's why we need to figure out where we can find the money. You said one key thing, which was the executive branch, and not to mean this branch, but previous executive branches because of neglect, irresponsibility, because we ended up with a 3-judge panel and a receivership. Obviously, we're paying the costs, and they're making unilateral decisions without approval, of the legislative body. You have a federal overseer, if you will, who have unilateral, and awesome powers that they can take from the budget, irrespective if they're having an impact on children, children who are autistic or on the spectrum. They have that power. And it's unfortunate that previous executive branches, because of their neglect, has put us in this position. So our expectation is through you and the secretary to find the cost savings as well, too, because it is very, very difficult to go out and speak with, especially with young people. And they're absolutely right when they say, why are we investing more money in prisons than we are in education in young men and women? We've created a prison industrial complex that it's its own, private enterprise or public, private enterprise that's taking a gargantuan amount of the state budget, and we want to protect the public. We want to make sure that the bad folks are behind bars and not harming anyone. But also, we have to make sure we rehab folks, so we can lower our recidivism rate, but do so in a manner that's cost efficient, takes a balanced approach. So I would really, really emphasize, Ms. Shimasu, your workers' comp. It seems like you're zeroing down on workers' comp, these runaway costs. Find other cost savings.
Right.
I think it's absolutely critical. I know that Ms. Mitchell specifically is a member of the Budget Committee and chair of Sub 3. So I know she's looking for every penny, under every pillow, and it's hard. It's hard when we see, CDCR again, So I think the legislative branch is really counting on you to mind the purse string, very, very closely. I got a feeling we're going to revisit this issue in the future many times, because it's absolutely critical. We need the revenue so we can make the investments in our children.
Right.
Okay?
I understand.
Any other questions from members? Seeing none, do we have, let's bring up those supporters of Ms. Shimasu. Those supporters of Ms. Shimasu. Any supporters? Seeing none, those who are in opposition. Also seeing no opposition, do we have a motion? We have a motion by Ms. Leyva. Madam Secretary, please call the roll.
Senators Canella. Aye. Canella, aye. Leyva. Aye. Leyva, aye. Mitchell. Aye. Mitchell, aye. Fuller. Aye. Fuller, aye. DeLeon. Aye. DeLeon, aye.
Ms. Shimasu, congratulations. You passed on a 5-0 vote. Thank you. Okay, colleagues, we're going to move on with our agenda. We should be done in a few moments. Let's go to file item number 3. These are governor's appointees, are not required to appear. Let's go to file item 3, C and D. C and D, can we get a motion? We have a motion made by Senator Mitchell. Madam Secretary, please call the roll.
Senators Canella. Leyva. Leyva, aye. Mitchell. Mitchell, aye. Fuller. DeLeon?
Aye.
DeLeon, aye.
Motion passes on a 3-0 vote. Let's go to file item number 3E. Can I get a motion? We have a motion made by Ms. Mitchell. Madam Secretary, please call the roll.
Senators Canella?
Aye.
Canella, aye. Leyva? Leyva, aye. Mitchell? Mitchell, aye. Fuller? DeLeon?
Aye.
DeLeon, aye.
Measure passes on a 4-1 vote. Let's go to floor acknowledgements. 4-0, I apologize. Let the correction stand, 4-0. Let's go to file items number 4 through 10. Can we get a motion? We have a motion made by Madam Vice Chair, Ms. Fuller. Madam Secretary, please call the roll.
Senators Canella?
Aye.
Canella, aye. Leyva? Leyva, aye. Mitchell? Mitchell, aye. Fuller? Fuller, aye. DeLeon?
Aye.
DeLeon, aye.
Motion passes on a 5-0 vote. Colleagues, thank you very much for your patience. This meeting is adjourned.